Millions are going to lose Medicaid coverage. This is due to a devastating House budget that President Trump has endorsed that is going to cut this critical health coverage that seniors, people on disability, and veterans depend on. I have all the news. I'm going to bring you all the details about this shocking news that is going to affect millions and millions of people. So the House of Representatives passed a budget that President Trump endorsed that is set to gut $880 billion from Medicaid. I'm going to give you 8 changes, 8 different groups that are affected, and then 10 changes that are going to happen to Medicaid as a result of this. If you're new here, hit the like button, hit the subscribe button, because all we do is bring you the latest news and update, anything in and out of Congress that's going to affect your food stamps, Social Security, Medicare, Medicaid, and any personal finance news that seniors care about. So before we even get started, let me know your city and state. Go into the comment section. Let me know where you're watching this broadcast from. I have a lot of news to cover with you today. Let's get started. So, what is this breaking news? Well, here are some of the headlines showing you exactly who they are working for. GOP votes to gut Medicaid for tax cuts, primarily for the rich. House Republicans have ignored the demands of their constituents and instead chosen to side with their billionaire donors. Another headline: House passes budget blueprint that would impact Medicaid and SNAP and deliver tax cuts that favor the rich. This resolution includes a massive reduction in federal spending, which experts say is highly unlikely to be achieved without cuts to Medicaid. Here is another: entitlements on the table. Medicaid, SNAP on GOP chopping block, not Trump's tax cuts for the wealthy. Well, a lot of people, when they hear that Medicaid is being cut, they're like, no, that's not going to happen. Well, it is primarily also because of confusion around Medicaid. Medicaid is called several things in several states, and so it may not be called Medicaid in your country, in your state, but it is still Medicaid. So let's talk about that. In California, it is called Medi-Cal. In Arkansas, it's called Health Care. In Hawaii, it's called MedQuest. So in different states, Connecticut, Husky Health. If you go to, say, New Hampshire, it's called New Hampshire Medical Assistance. New Jersey is called Family Care. Oklahoma, Sonacare. So when we talk about Medicaid, a lot of people are like, oh, I don't think it's happening to me. Well, it is because Medicaid is called different things in different states. And it is the third largest thing on the federal budget and impacts 82 million people. Well, President Trump has endorsed this House budget bill that is going to cut Medicaid and food stamps and raise money so that they can cut taxes that primarily benefit the rich. If you don't think this is going to impact you, stay with me. I'm going to walk you through the 8 groups that are going to be impacted by this devastating bill. So let's get started. The first one is children. Approximately 40 to 45% of Medicaid recipients are children, representing over 30 million young Americans who rely on the program for basic health care. Many of these families have been working, parents that are working but could not afford health care, or their companies don't provide health care and have to depend on Medicaid for health care. Elderly and disabled. Medicaid is the primary payer of long-term care. A lot of people don't know this, but the primary payer of long-term care in America is Medicaid, covering about 62% of nursing home residents. Cuts will particularly affect older Americans who have exhausted their savings on health care and now rely on Medicaid for continued care. Working families. Many Medicaid recipients are employed in low-wage jobs that don't offer affordable health insurance. Cuts will force these families to choose between health care and other necessities like food and housing. Rural communities. This is why I want you to pay attention. Rural hospitals and healthcare facilities rely on Medicaid reimbursement to remain operational. Without Medicaid, a lot of rural hospitals will shut down because their primary source of income is through Medicaid reimbursement, because most of their patients are people that are on Medicaid: veterans, seniors, children. Another group is people on Medicare that are dual eligible for Medicaid. They are called dual eligibles. Approximately 12 million seniors are dual eligible, receiving both Medicare and Medicaid. Why is this important? Well, for this group, Medicaid pays for their Medicare premiums, deductible, and things that Medicare does not cover. So these 12 million seniors are now at risk of losing their benefits because of these deep cuts. Medicare premium assistance. For many low-income seniors, Medicaid pays their Part B Medicare premiums. I bet you don't know this. That is $185 a month, making Medicare affordable for them. If Medicaid assistance is cut, many seniors will be unable to afford their Medicare premiums and effectively lose both coverages. Supplemental benefit loss. Those who are dual eligible, also dual eligible Medicare Advantage plans provide important additional benefits like dental, vision, and hearing coverage that original Medicaid does not cover. Losing Medicaid eligibility means losing access to these specialized plans and enhanced benefits. Let's talk about medical debt. Without the protection of Medicaid covering costs Medicare does not cover, many seniors will face significant out-of-pocket expenses, leading to medical debt. This is particularly concerning for those requiring extensive care or prescription medication. Now, where is this all coming from? Well, there's a backward methodology going on. The current approach, which is born out of Doge, is they are cutting things and then asking questions later. The current approach proposes cutting budgets first and then investigating fraud later, rather than identifying specific fraud cases before reducing funding. This put legitimate beneficiaries at risk while supposed fraud is investigated. So basically, what they're doing is slash and burn rather than deliberately finding the fraud, eliminating the fraud, and then doing the budget cuts. But they're doing both at the same time. And then the disproportionate impact. The cut first, verify later approach disproportionately harms the most vulnerable populations, including elderly, disabled, severely ill individuals who may lack the capacity to effectively advocate for themselves. Many will go without needed care during lengthy appeals process. So people are going to, the way that Elon Musk and his crew are doing things, they are just cutting things indiscriminately. It is affecting people. And part of this cuts, especially with this House budget, is that many are going to lose benefits that they need, and then they have to appeal. And while the appeal process goes through the bureaucracy, you are losing critical care that you need, and it's going to be devastating, especially for seniors that need critical care. Verification burden. If benefits are cut pending verification of eligibility, one of the things they're trying to do now is make it harder for you to get benefits, or you have to verify that you're eligible for benefits. And what happens is that while you're in that process, that is taking your benefits away while you get to show that you deserve it or you're eligible. So if benefits are cut pending verification of eligibility, beneficiaries face the burden of proving they qualify, often without resources or assistance needed to navigate the complex bureaucracy. This can leave vulnerable people without needed care for extended periods of time. And on and on. Now, where is this going? It is important to understand how this is going to unfold. Republicans in Congress have issued budget reconciliation instructions. So rather than passing this in the Senate with 60 votes, where Democrats can block this, because Republicans don't have 60 votes in the Senate, they only have 53. So Democrats can block this from happening. However, there is a budget process called reconciliation that Republicans are trying to use to pass this devastating cuts to Medicaid and food stamps through the Senate. It only requires a simple majority. And since they have 53 votes, they have enough people to pass this. So let me explain how the reconciliation works. Republicans in Congress have issued budget reconciliation instructions that target significant spending cuts, including $888 billion from the Energy and Commerce Committee. That is where Medicaid is overseen. So that is the committee that oversees Medicaid, the Energy and Commerce Committee. This process allows major program changes to pass with a simple majority rather than the 60 votes typically needed in the Senate. While some politicians claim there are no cuts to Medicaid, they're going to tell you this. You're going to hear this a lot. Oh, we're not going to cut Medicaid. That is a lie, because there is no way you can cut $880 billion out of the Energy and Commerce Committee without cutting Medicaid, because Medicaid is the third largest bill on the federal budget. First is Social Security, and second is Medicare, and third is Medicaid. So since Medicaid falls in the Energy and Commerce Committee, anybody getting on camera and telling you we're not going to cut Medicaid is lying to you, because that's exactly what they're doing. And I'll show you evidence if you stay with me, because it's been reported extensively in the news that they're gutting Medicaid. So they're going to go through this reconciliation process, and their target is to cut $880 billion from Medicaid, and then $230 billion from SNAP, and then $330 billion from education and workforce. All this to finance tax cuts that primarily, overwhelmingly benefit the rich. So let's talk about tax cuts. Those budget proposals align with efforts to fund tax cuts that will primarily benefit high-income Americans, similar to how the DOGE dividend proposal would exclude lower-income people. The $880 billion in Medicaid cuts is roughly twice the amount proposed for DOGE dividends. Just as DOGE dividend would exclude Americans who don't pay taxes, federal taxes, the proposed Medicaid cuts will likely tighten eligibility requirements. In both cases, those in need of assistance will be the least likely to receive it. While potential cuts will take relatively effect very quickly, once they pass the budget through the Senate, it's going to take effect. Any benefits from DOGE is not going to come until 2026, July at the earliest. So what does this all mean? What can you do? What is Congress saying? Do your congressional leaders care about the fact that millions of seniors, veterans, and children are going to lose their benefits? Well, let's hear what they have to say. Speaker Mike Johnson has emphasized fiscal responsibility and debt reduction, saying that we have a $36 trillion debt. We have a deficit that we are contending with. So he's focused on deficit reduction, and that's why they want to cut these programs. But they're not telling you that they're using it to finance tax cuts. Representative Jasmine Crockett has criticized the DOGE proposal. Talking about the fact that why are they cutting targeting Social Security, Medicaid, Medicare, SNAP, housing benefits, while vulnerable populations are suffering? Why are they going after these programs? But is this going to make any difference? The Republicans have access to the House. They are the majority in the House. They are the majority in the Senate. They have the presidency. They can do whatever they like. So what can you do? How can you protect your Medicaid? Right now, this is the graph. They're going to cut $880 billion from Medicaid, $230 billion from SNAP, and then all of it is going to total $1.1 trillion to finance tax cuts for people with incomes in the top 1%. That is primarily who these tax cuts are going to benefit. So you can call or write to your senator, because now that it has passed the House, it is moving to the Senate. So write and call your senator and let them know that Medicaid cuts is not a good idea. You can call the switchboard at 202-224-3121, and they will connect you to the legislator's office. Stay informed like you're doing right now. Monitor reliable news sources and other government communications for updates on potential program. You can go to Congress's website. Everything is on their website. That is where I got all my information from and came to you to show you what is in the bill. So you can go to congress.gov and see it for yourself. This is news that is available to all of us. Organizations like the AARP and Medicare Rights Center also provide accurate information about threats to healthcare programs. Document your eligibility. Gather and organize documentation that proves your eligibility for Medicaid and other benefits. Having these records readily available will help if you need to verify your eligibility or appeal any incorrect termination of your benefits. You can see how DOGE is slashing things left and right. They are laying people off that they have to hire back because they make a mistake. They are going to cut these benefits indiscriminately, and then you would have to go back and prove that you are eligible. So gathering your documents to prove that you're eligible for Medicaid is very important, so that if you need to verify your eligibility, you have the documents readily available to do it. And then connect with advocacy organizations that focus on healthcare access for seniors and low-income groups. This group can provide guidance on protecting your benefits and may organize collective action to oppose harmful cuts. Now, we've talked about Medicaid and who is going to be affected. Well, these are the 10 changes that is going to come to Medicaid as a result of this Trump bill that is headed to the Senate that is going to gut Medicaid. But before I talk about that, a lot of you have been going into the comments and talking about Medicare. You've been sharing your horror stories about being dropped from Medicare or your coverage being not what they told you was going to be. A lot of you have had facilities close or your doctors all of a sudden drop from your network. Well, here's some good news. We have partnered with Chapter Medicare. During this open enrollment period, there's a small window that ends on March 31st this month where you can switch to a better Medicare plan. Well, Chapter will offer you free assistance. So call the number on the screen. They are the only advisory company that have access to all 24,000 Medicare plans in the country. And it said that 90% of seniors are in the wrong Medicare plan. That is why a lot of you are having your coverage dropped or not having the benefits you need. So here is the thing. Here's the reason why we partnered with Chapter. They do not work for commission. Their agents do not work for commission. So when they get on the phone with you to help you find the best Medicare coverage, they are not trying to sell you the highest plan to get the best commission. They are primarily there to help you find the best plan that fits your budget, that fits your need. So call them. They can save you an average $1,100 per year. So call the number on your screen for help on your Medicare Advantage. Don't wait. It ends on March 31st, and then the window closes, and then you cannot do anything about Medicare until the fall. So let's talk about the 10 different things that are going to change under this Trump cut to Medicaid. The first group that's going to be affected is the Medicare, Medicaid dual eligibles. Approximately 12 million low-income seniors and disabled individuals could lose critical coverage. Many will be unable to afford the $185 monthly Medicare Part B premium currently covered by Medicaid. Loss of coverage for senior services like Medicare does not cover would include long-term care, dental, vision, and hearing services. Increased out-of-pocket costs could force many of those between healthcare and other necessities. Reduced access to specialized Medicare Advantage dual-eligible plans that could provide additional benefits. That is the first group. Let's talk about nursing home residents. Medicaid covers approximately 62% of all nursing home residents, making cuts particularly devastating. And here is the news right there. $880 billion in Medicaid cuts from the House budget. And it says President Trump endorses GOP House bill with huge cuts to Medicaid and food stamps. This is directly from CBS News. Trump was on camera saying he endorses the bill that just passed the House that is heading to the Senate that's going to gut Medicaid. Reduced reimbursement rates will force many facilities to close, that is nursing homes, especially in rural areas, because they depend mostly on Medicaid clients. Stricter eligibility requirements will force more middle-class families to exhaust savings before qualifying for Medicaid. Quality of care would likely decline as facilities try to operate with less funding because they are losing their Medicaid reimbursement, and families will face difficult choices between inadequate care and financial ruin. This is really devastating, guys. Let's talk about home health care recipients. Medicaid is the primary payer of home and community-based services that allows seniors to age in place. That's why I keep saying that when I talk about Medicaid, a lot of seniors feel like, oh, it does not affect me because I'm on Medicare. Well, Medicaid pays for a lot of services that seniors depend on. In this case, home and community-based services that allow seniors to age in place. With these cuts, reduced funding will limit the availability of home health aides and personal care assistants. Wait lists for those services, already years long in many states, will grow substantially. More seniors will be forced to institutional settings against their preferences. So seniors will be forced into institutions that they would rather age in place at home and now have to go to institutional facilities that they probably do not want or their family do not want. And family caregivers will face increased burden without support services like Medicaid. Let's talk about rural communities. This is where I think is going to be very, very tough. Health care facilities in rural areas depend heavily on Medicaid reimbursement. Rural hospital closures will accelerate, with more than 600 already at risk nationwide. Travel distances to receive care will increase dramatically for rural residents. Local economies will suffer from healthcare job losses in areas where these are often the major employers. A lot of rural areas, these hospitals and healthcare facilities are a major source of employment for people. Preventative care will decline, leading to more serious health conditions going untreated. Let's talk about children with special needs healthcare. If you know somebody in your family that has special needs child, pay attention because most of them depend on Medicaid for help. Medicaid covers specialized services for approximately 14 million children. Early intervention services for developmentally delays will be reduced or eliminated. Specialized therapies and adaptive equipment will become unaffordable for many families. School-based services for children with disabilities could be cut as schools lose Medicaid funding, and families caring for medically complex children will face devastating financial consequences. Let's talk about pregnant women and new mothers. They are also going to be impacted by these Medicaid cuts. Medicaid currently covers nearly half of all births in the United States. Reduced prenatal care will lead to increased maternal and infant mortality rates. Postmortem coverage, recently expanded in many states, will likely be cut back. Rural maternity wards, already closing at alarming rates, will become even scarcer, and women at risk with high-risk pregnancies will have fewer specialized care options. Let's talk about mental health and substance use patients. Now, this is Steve Bannon, who supports the president, who has joined with hospitals over GOP rebellion against these cuts. So even Steve Bannon, one of the staunchest supporters of the president, is voicing his concern that if they do this, if they gut Medicaid like they are planning to, if they cut Medicaid like they've done in the House bill that just passed that the president endorsed, it's going to affect his base significantly. And one of the areas is home health and substance use patients. Medicaid is the largest payer of behavioral health services. Community mental health care centers will face funding cuts or closures. Wait times for psychiatric care will increase dramatically. Substance use disorder treatment programs will be reduced as states cut optional services. And the ongoing opioid and mental health crisis will worsen, particularly in hard-hit rural areas. And I'm taking my time to explain Medicaid because I know a lot of people, when they hear Medicaid, they only think about, oh, this is Medicare, medical health for the poor. They don't realize how extensive Medicaid covers a lot of people in a lot of areas. They don't even realize it because it may be called something different in your state. Another area is working adults with chronic conditions. Many Medicaid patients work in jobs that don't offer health care. So a lot of people that are covered by Medicaid, especially adults, are working in jobs that don't offer health care. So their only option is expanded Medicaid to states. So stricter work requirements will ignore the reality that many chronic conditions make consistent work difficult for some people. Those with conditions like diabetes, asthma, and heart disease will lose preventative care. Productivity losses will escalate as manageable conditions become disabling without treatment, and emergency room visits will increase as primary care become inaccessible. Now, let's talk about a critical group that is going to be impacted by these devastating cuts to Medicaid: veterans. Not all veterans qualify for VA healthcare. Did you know that? Not all veterans qualify for VA healthcare, making Medicaid essential for many veterans. Approximately 1.7 million veterans rely on Medicaid for their health coverage. Those with services connected issues that don't qualify for VA disability will lose access to care. Veterans in states without VA facilities nearby will face reduced access options, and mental health services, crucial for veterans with PTSD, will be harder to obtain. Direct care workers. Ironically, many healthcare workers who provide Medicaid services rely on Medicaid themselves. So a lot of home health aides, all these people that help support the Medicare system, are actually on Medicaid themselves. These essential workers, primarily women and people of color, will face both job losses and personal loss coverage. Workforce shortages in nursing homes and home health services will worsen. Remaining workers will face increased workload and poorer conditions. The care infrastructure for aging population will be further destabilized at a time when demand is growing. So let me know what you think. I know this is a lot that I brought to you. It may be upsetting, but here's the thing. This is happening right now. The House just passed the bill. You can go online to the House website. You can go find your favorite news organization. They have probably reported about this. So it is not something that you can say, I'm being biased, I'm picking and choosing where. No, you go find your favorite news organization and they'll tell you the House just passed a bill to gut Medicaid to get $880 billion from Medicaid, $230 billion from food stamps. That is a fact. It's going to move to the Senate. And because they're using reconciliation, they don't need 60 votes because the Democrats could have blocked this in the Senate. They could not block it in the House because they only need a simple majority in the House, but they could have blocked it in the Senate because they need 60 votes. But they're using reconciliation to pass this in the Senate, which only requires a simple majority in the Senate. And so this is guaranteed to pass the Senate unless a lot of people make noise and call their senators and tell them that this is not okay because gutting Medicaid, $880 billion will affect veterans, will affect children, will affect seniors who want to age in place, will affect dual eligible seniors who are on Medicaid and Medicare that depend on Medicaid to pay for their services that Medicare does not cover, to pay for their Medicare premiums, to pay for their out-of-pocket costs, and it's going to affect nursing homes because 62% of all nursing home stay is paid for by Medicaid. And so if they're taking this kind of money out of the program, the burden is going to fall on families to have to finance long-term care, memory care, assisted living help for seniors. So I hope that we all make enough noise so that this will be stopped in its tracks. Otherwise, once it gets passed, Medicaid is going to be devastated in ways that we've never seen before. So let me hear your comments below. Are you going to be impacted by this? What do you think about all of this? And what are you going to do to fight back? Let me know in the comments, and I will do another live bringing you the changes that are going to come to food stamps tomorrow. So stay tuned. Tomorrow night, I'm going to do a whole new live talking about the devastating changes that are coming to SNAP benefits as a result of this budget bill that is headed to the Senate. So thank you for hanging with me this Saturday night, and I will see you all tomorrow.